Hello everybody, hi. With the really sun scorching us and the temperatures becoming phenomenally high, it's really a difficulty to sort of keep our kids safe and sound during this period. So I'll be talking to you in very short about what we can do to keep our kids really cool and healthy during this point of time. The first and the most important thing, of course, is to avoid the scorching sun as much as possible. So to keep the kids little indoors if possible between 11 to 4 and not expose them directly to sunlight. Now we have to understand that kids do actually warm up pretty quick and they develop a lot of sunburns, they lose out a lot of moisture, they become dehydrated pretty quick. So of course we got to keep them well hydrated. So give them plenty of water, juices, plenty of fluids as much as possible. Small babies, breastfeeding, absolutely imperative till the first 6 months. Beyond 6 months, there might be a little bit of formula feeds along with complementary feeds along with the breast milk. But fluids is of prime importance. The babies and the children should have appropriate clothing. The clothing should be preferably light colored and they should be covering the hands and feet when they go outside because that will reduce the risk of exposure. There will be lesser amount of layers, so fine softer clothing, preferably cotton. Avoid using synthetic linen totally, and definitely no layers and no excessive clothing that's harmful even for very small kids. The temperature of the room should be kept preferably if possible between 25 to 26 degrees, and that should be ambient temperature. The fans may be on, there must be well sort of ventilation of the room, and everything needs to be clean. The right food is a very important things. Breastfeeds, as I have said before, for the first 6 months, no water till 6 months. Beyond to 6 months, plenty of fruits and vegetables, especially which contain a lot of fluids in it, like cucumber, like a lot of juices. Any juices can be given, preferably homemade juices, or even things like dab would be fine. Even lassi and water should be adequate. Everybody should be particularly emphatic about having potable water along with them, so they should carry the water bottles, and that will also save them from exposure to non-potable sources of water. And I wouldn't definitely advise children on getting juices from the roadside. Of course, it has to be sterile juices. Juices like dab, lassi, homemade juices is very important. Swimming is a very good, it's a very good exercise, and preferably swimming in an indoor pool would be preferable, but it's not possible. So even if you go for a swim, make sure that the child has a proper bath before and after, and the temperature of the water should be preferably sort of, either lukewarmish or normal temperature water. Washing of hands is a prime importance because this is the time to pick up things like acute gastroenteritis, typhoid and other things. So washing hands is very important. Regular soap bath and shampoo is of prime importance as well. Remember, diseases such as acute gastroenteritis, fever of different types, and even things like typhoid, cholera are rampant during this point of time. So everybody must make sure that they take the appropriate vaccines, especially for things like polio, rotavirus, influenza, as well as typhoid, along with the standard other vaccines that are normally given at this point of time. Some people ask us about massaging. Massaging is very good for children, and it should be done preferably with cotton oil, with coconut oil. I'm sorry. Well, in the end, I would like to emphasize that fevers are very, very common in children at this age. So you must know what to do if your child is overheated. Overheating is one of the main causes of fever. So if your child does have fever, make sure that the child is kept in the cool. Make sure that the child has a regular bath. Cold sponging, especially with normal tepid water, should be done whenever the temperature goes more than 101 degrees. Do not stop bathing a child during fever, and give plenty of paracetamol. Give plenty of fluids to keep the child hydrated, and that's very important. I wish you all a very safe and healthy summer. I'm pretty sure a lot of you will be going on excursions, camp holidays, and even have holidays. Just make sure that you keep yourselves safe and sound. Thank you.